I am here in Larkana to investigate what could be Pakistan's worst HIV outbreak. According to the National AIDS Control Program, over 800 children are suspected to be HIV positive. In Pakistan, HIV is on the rise. An estimated 165,000 people are living with HIV today. In 2010, there were 67,000 people living with HIV. As of November 2019, 36,940 people have been tested for HIV in Larkana. The numbers are steadily increasing. There could be thousands more that do not know their status and have never been tested or reported. A country where half the population is illiterate, there is much to be done to spread awareness about the disease, which in Pakistan primarily affects the underprivileged. Currently, Pakistan is battling its 8th HIV outbreak. Out of the 8, 4 such outbreaks were in Sindh, the rest being in Punjab. 3 out of those 4 outbreaks that have occurred in Sindh were in Larkana, where we are currently seeing a very critical situation develop. In April 2019, 2 children tested positive for HIV in Ratodero village in Larkana, and the media took the story by storm, creating widespread AIDS panic in the country. Over the next few weeks, hundreds more tested positive in Ratodero, and the nightmare became a reality. The worst part, to date, 926 of 1,161 people that were found to be HIV positive are children under the age of 5. 41 of those 1,161 that were tested positive have died, 37 children and 4 adults. Before the alarm bells could go off, already hundreds of children had been infected. In the early days of the outbreak, 125 of the 145 who initially tested positive for HIV were Dr. Muzaffar Khangro's patients. Dr. Khangro, who was accused of deliberately infecting patients with HIV, also has HIV and is one of the only pediatricians in Ratodero. He was in custody for several weeks and was released in September. We tried to contact him to give us his side of the story, but his number could not be reached since his release. According to sources, he is currently working at a private hospital despite the charges and ongoing investigation against him.
कहते हैं इसको बीमारी है, ये सारी जिंदगी किसकी मोहताज करेंगी? हमारे गांव वाले हमारे घर नहीं जाने देते हैं, तो तुम्हारे बच्चे हमारे घर नहीं आए, तुम्हारे बच्चे को HIV है, हमसे मिले नहीं, ये इसकी जिंदगी क्या होगी? ये डॉक्टरों ने की है ना, क्यों की है इसने? ऐसे डॉक्टर क्यों हुए हैं? ऐसे डिग्री पर लानत है जो हमारे बच्चों की जिंदगी बर्बाद कर देती हैं। देख कितने बच्चे हैं, एक लड़के हैं, लड़की हैं, सारी जिंदगी पड़ी है। अब भी ये हम माँ बाप सारी जिंदगी तो अपने बच्चों के साथ रहेंगे नहीं, ये किसके सहारे अपनी जिंदगी गुजार लेंगे? भाई भाभी क्या इसकी इतनी परवरिश कर सकेंगी? वो अपने बच्चे के लिए इसको दूर करेंगी, दूर हो जाओ, हमको बच्चे पे दें, इसको हाथ मत लगा, हमारे साथ मत बैठ, उधर बैठ, हम माए तो मर जाएंगे, ये क्या जिंदगी गुजारेंगे? हम कहते हैं ऐसे डॉक्टरों से गोली मार दिया, हमको ऐसे डॉक्टर नहीं चाहिए।
Not only is he the first journalist who reported on this story, but him and his family are suffering from the HIV epidemic as well. Their daughter, Rida Batur, has the illness. She's tested positive, and we're going to ask him about his story.
बड़ी बात है, इतना आउटब्रेक हुआ है, अभी भी गवर्नमेंट ने HIV का डिजीज स्पेशलिस्ट नहीं रखा है।
जो ये टेस्टिंग सेंटर है जहाँ पे ट्रीटमेंट भी मिल रही है, उधर जो डॉक्टर्स बैठे हुए हैं वो इन्फेक्शियस डिजीज के स्पेशलिस्ट नहीं है।
कोई भी नहीं है, न लारकाना में है, न
जो SACP और UNAIDS
ये है MBBS डॉक्टर है, इन्होंने क्या किया है कि इनको 10 दिन की ट्रेनिंग दी है।
पूरा जो ये बड़ा शहर है
हाँ।
उसमें जितना आप घूमे हो
हाँ।
क्लिनिक्स में, अप्रैल से पहले कोई टेस्टिंग किट मौजूद नहीं।
गवर्नमेंट में भी नहीं थी। यहाँ कोई ये पीपीएस है, जो ये लेबोरेटरी है जो वहाँ उन्होंने ये रखी थी। जो लोग ये डॉक्टर भेजते, डॉक्टर इमरान अकबर अरबन वो भेजता था पीपीएस को, वहाँ से वो पॉजिटिव आ जाती है। जीआईटी टीम जो सूरत देरे पहुँची है, जिनमें ऐसे ये कैंप लगी तो उन्होंने गवर्नमेंट ने उनको ये जो एम्प्लॉय यहाँ काम करते थे उनको मना कर दिया। एक तो मीडिया को ये आप नहीं बताएं, ये जो फिगर्स है ये आप हमें बताएं डायरेक्ट। इनको अगर 50 होता है इनको 3 बताएं, इनको 5 बताएं। तो ये शुरू से ही ये फिगर्स ये छुपाना शुरू कर दिया।
ये बच्चे दर बदर हो रहे हैं, एक्सरे के लिए 4-4 दिन वो घूम रहे हैं, एक्सरे नहीं निकल रहा है वहाँ लारकाना में। मैं खुद जो है ना वहाँ जाता हूँ, मुझे पता है।
ये गवर्नमेंट के लोग जो यहाँ होते हैं उन्होंने मुझसे रब्ता किया कि पहले तो मुझे खामोश कराने के लिए उन्हें बहुत से मराते देना ऑफर की कि भाई जैसे दूसरे साफ ही लेते हैं हमसे
पेमेंट्स वगैरह,
आपको क्या चाहिए, आपको ठेकेदारी में आपको शेयर देंगे, नौकरियाँ आती है आप उसमें जो है ना अपनी डिमांड्स रखें, हम वहाँ वो आपको देंगे, और भी बहुत से सहूलियात हैं जो हम आपको दे सकते हैं। लेकिन मसला ये है कि आप जो है ना लोगों को ये नहीं बोल। मैंने कहा एक मैं तो साफ ही नहीं हूँ। अगर मैं चुप हो गया या तो लारकाना या रतोडेरों में बहुत से साफ है, लेकिन उन्होंने कहा नहीं शुरू आपसे होती है। हर आदमी ये चाहता था कि हमें टेस्ट हो, हमें इत्मीनान हो कि ये वायरस हमारे बच्चों के खून में नहीं है। तो मैंने भी कहा कि तुम भी जाओ, तो मेरे बच्चे सारे जो है ना वो गए वहाँ टेस्ट करवाए। तो मेरी वाइफ ने फ़ोन किया, ये रेता को HIV पॉजिटिव है और बच्चे सारे नेगेटिव है, मेरी वाइफ नेगेटिव थी। तो मुझे बोला तुम भी आ जाओ। मैंने भी अपनी करवाई, मैं भी नेगेटिव, मेरी वाइफ भी नेगेटिव। मैंने कहा सर मेरे जब मैं नेगेटिव, मेरी वाइफ नेगेटिव, मेरे दूसरे बच्चे नेगेटिव है, इसको कैसे 2 साल की है, ये कैसे हो गया? उसी दिन मेरे पैरों तले ज़मीन निकल गई और मैं कह रहा था जिस आग को मैं बुझा रहा था, इस जो आग लगी थी HIV की, उसको मैं बुझाने की कोशिश कर रहा था, वो आग तो मेरे घर में लग गई है। मैं अपनी बच्ची को लेके गया वहाँ सेंटर पे, तो वहाँ देखा कि वहाँ तो कोई HIV का डॉक्टर ही नहीं है। मैं एक्सरे पे गया तो मुझे इतना रश था एक्सरे पे, तो एक मशीन थी एक्सरे की लारकाना में, वहाँ अंदर गया जब एक्सरे मशीन की तो वहाँ इतना खून लगा था। वो मेरे उन्होंने कहा कि बच्ची को लेटाओ यहाँ पे, इसका एक्सरे निकालेंगे। तो वहाँ जो है ना वो जो खून लगा हुआ था, तो मैंने कहा यार इसको साफ तो करो, मैं अपनी बच्ची को कहाँ बैठाऊँ? चाहिए यार तुम अब साफ करो इसको। तो मैंने क्या किया, मैंने अपने कपड़े उतारे, अपनी गंजी से बनियान से वो मैंने वो खून साफ किया। ये सोचा मैंने अपनी वाइफ को बताया कि हमको इसको इतना बोर्ड करना है, इतना बोर्ड करना है, इसके जहन में ये डालना है कि ये कुछ भी नहीं है। ये बीमारी जैसे शुगर होती है, जैसे हेपाटाइटिस B-C होती है, वो लोग और भी तो बीमार है ना।
आप मजबूत बने।
हाँ, इसको हम इसकी तरबियत ऐसी करेंगे कि ये मजबूत है, ये ऐसे फील करे कि ये HIV क्या है, कुछ भी नहीं है। ये इसको हम इतना स्ट्रांग करेंगे कि ये अंदर से मजबूत हो।
I'm here with Dr. Fatma Mir, and she is the Associate Professor for Pediatrics at Aga Khan University. In addition to that, she's also a Pediatrics Infectious Disease Specialist and has been running the Pediatrics HIV Center by support of the Sindh AIDS Control Program for the last 10 years.
The Aga Khan University is partnering with the Ministry of Health and with the Sindh government and with the Sindh AIDS Control Program to launch a formal investigation into why this has happened, and we are doing a case control study in which we are collecting blood, we are doing interviews with kids who are infected and age and gender matched kids who are not. The majority of the children have not had a blood transfusion, do not have positive mothers, they have not had sexual contact. all of them, almost 99% of the kids have had repeated injections from local physicians, local quacks, local dispensers, local nurses for very, very minor complaints.
Going back to the outbreak in Larkana, the numbers that we are currently seeing, do you think that they will stop there or be concentrated to a certain group, or do you fear that these numbers are going to increase?
I feel the numbers will increase because these numbers we have in Larkana were based on voluntary screening.
So we could see more numbers in
Yes.
Larkana of people that haven't yet been tested.
Yes.
How can this infection be contained and prevented from spreading further at this level?
So the one peculiar thing about pediatric HIV is this is a sexually inactive age group. They have to be sexually active, they have to be pregnant, or they have to give blood to somebody in order to spread it.
So later
now the
in
one-
life, they would be transmitted.
Yes, so they will become more and more infectious when these behaviors begin, once they become adult. If they have medicine, they will have a normal life expectancy, they will live well. But these are medicines. They may have side effects. You will have to come daily, regularly, every month, every 2 months to the physician to show the child. I've run the center at AKU, and over these 10 to 12 years, we've sort of taken care of almost 94 to 96 children. And some of them passed away because they were very, very unwell when they came to us and they didn't respond well to the medicines. But most of them have grown up, are in college, are doing well, and have passed on into the care of the adult HIV care physician. So HIV, in this day and time, if the child is on treatment and has responded well to it, and most of them do, is compatible with a normal life.
So we are in Ratodero city now. This is the old part of the city where the British used to live. And here we've come to a home, the home of Leila Khatoon's brother. We are going to discuss her story. She had a cesarean section through which then she became HIV positive through medical negligence. This is another story of medical negligence in Larkana. लैला, आप मुझे ज़रा ये बताओ कि आपको कब पता चला कि आप HIV पॉजिटिव हो और कैसे हुआ?
जब ये नंदड़ा ठीक नहीं था, बहुत दिखाया था, बार बार दिखा रही थी, डॉक्टर इमना मुझे जा रही थी, वहाँ पता चला, उसने कहा डॉक्टर इमना ने एक रिपोर्ट को लिखता देता हूँ, वो कराओ।
HIV पॉजिटिव है कौन अभी आप दोनों में?
ये था। हाँ।
आपको नहीं हुआ?
अब पहले मेरे को नहीं टेस्ट कराया था।
अच्छा।
फिर इसको कराया। फिर
इसको आपने कब कराया?
रमज़ान में
2 माह पहले।
हाँ, 2 माह। इसको कराया, इसके बाद में मैं गई, वहाँ गुराया रतेजरे अस्पताल में बड़ी।
तो आपको कुछ बताया बीमारी के बारे में कि बीमारी है क्या और ये सब, उन डॉक्टर्स ने जिनसे आपने टेस्ट कराया?
डॉक्टर ने कहा तो बीमारी जो बड़े की है तो वो छोटी नहीं जाती, बस छोटे की है वो जा सकती है 3 साल के बाद। हमने कहा ये 3 साल के बाद जा सकती है। बड़े इसने इलाही से गोड़ में माण्हू उन्हनि असांखे घणो ई बोझ ॾिनो त मतिलबु हिनखे हीअं न कयो, हिन सां खाओ न खाओ, हिन सां मानी न खाओ, हिनखे हिन जो बर्ताव कर ॾिसो, हिन सां हीअं न कयो, हिन जे कपिड़नि खे न टच कयो, हिन जे कपिड़नि खे हिन कयो, हिन जी रत न लॻणी घुरिजे, घणो ई कयो कुझु। असां चयोसीं त हिन असांजे घर में कंहिं बि ईअं न आंदो विझेर या छा थींदी आहे छा न थींदी आहे, छा कुझु बि न हुयो। ख़ैर दलाली ॻाल्हि हुई। बाक़ी जेके बाक़ी घरनि में हुई इहा ई असांखे पाड़े में छोकिरीअ खे ॾसी आहिनि, हुन सां बेहद हालत किनी कई आहिनि।
पहले आपके खावंद को भी नहीं पता होगा कि क्या बीमारी है, तो आपने उन मुश्किलात का कैसे सामना किया और क्या अभी भी वो है?
नहीं, पति का नहीं है, वो सही है। बाकी जो घर वाले कुछ डरते हैं लोगों की बातों से।
पहले क्या रिएक्शन था आपके खावंद का?
नहीं, खावन का नहीं, पहले कुछ सही था, नहीं पहले, अभी कुछ है।
इन्होंने आपका साथ दिया?
अब साथ इसने दिया, इसने मेरा साथ नहीं छोड़ा।
और ससुराल
ने भी साथ दिया, बाकी काम भी लगी, जो बुआरा है इसमें चिंगार ना डालो, मगर तो को चीर आ जाए।
आपको मुस्तकबिल कैसा नजर आता है?
टूटा,
क्यों?
बस टूटा नजर आता है। कुछ बातें होती है जो बताई नहीं जाती, कुछ बातें होती है जो समझाई नहीं जाती।
डर लगता है आपको?
नहीं,
बच्चे का डर लगता है आपको?
यस,
अपने से ज़्यादा बच्चे का लगता है?
कुछ भी थे, शाबी थे, मतलब पंहिंजा आहिनि, पराया आहिनि, पर पंहिंजा जॾहिं पंहिंजनि खे कुझु थींदो आहे त पंहिंजो बि साथ छॾे ॾींदो आहे। इन लाइ जेतिरी असांजे लाइ इन हुकूमत दवा ऐं दारू ॾिनियूं आहिनि, तेतिरी असांजे लाइ हुकूमत हिकिड़ो जुगो बि ॾे आहे जो असां पंहिंजो घर धारा करे सघूं। घर खे वठी करणु वक़्तु उन में 1000 बार सोचणो थो पए त उहो वठी करणो या न करणो। घर जो बुआरो करणु वक़्तु 1000 बार सोचणो थो पए, या घर जी बुआरी ॾियूं या न ॾियूं, उन घर जो कमु कयूं या न कयूं, उन में सोचणो थो पए। सहे ॻाल्हियूं ईंदियूं आहिनि, सहे बात ईंदो आहे। नंढड़े जी जॾहिं टिकणी थियण वारी थींदी आहे, उन जा जेके वार लहण वारा थींदा आहिनि उहे फिटी कया बीहबा आहिनि। उहे सोचे ऐं माउ खे हिकु दर्दिल ते ॾुख थींदो आहे, कंहिंखे कुझु न थींदी आहे, बसि हिकु वात खे चुप हूंदी आहे, ॿियो लाख खे चुप हूंदी आहे। चींदी आहे बसि छा कयां, मुंहिंजो बि तव्हांजो न आहे बि कयो अलाह, कयो बि अलाह आहे, अलाह सां छा करिणो आहे, न ॾिनी अलाह आहे, छॾाईंदो बि अलाह आहे।
In Larkana, it was Dr. Imran Akbar Arbani who discovered that several young children had contracted HIV. We're here today at Dr. Imran Akbar Arbani's clinic, and he is the doctor who first detected the outbreak in Ratodero before it hit the news and before everybody started figuring out the scale of this epidemic. Dr. Arbani, मैं आपसे टेस्टिंग सेंटर के हवाले से पूछना चाह रही थी। अभी वहाँ पे हमने विजिट किया तो उधर जो लोग टेस्टिंग के लिए गए हुए थे वो HIV से वाकिफ़ भी नहीं थे, उनको पता भी नहीं था कि HIV क्या होता है। तो मैं आपसे ये पूछना चाह रही थी कि वहाँ पर जो टेस्टिंग हो रही है आप उससे सेटिस्फाइड हैं? Is the testing thoroughly being done?
33 babies have died up to now, up to today.
The numbers
33,
are
yes,
33.
33. I can show the list of those babies. This is the list of those babies which have died due to this HIV outbreak. इन सब की रिपोर्ट्स पॉजिटिव हैं, पड़ी हैं, और इन सब की पिक्चर्स भी हैं, और इन सब के वालिदैन से हम बात भी कर सकते हैं और वो कहेंगे कि हम चक्कर काट के थक गए, यहाँ अनअवेयरनेस ने हमें मारा है। सबसे ज़्यादा अनअवेयरनेस, दूसरी चीज़ गुर्बत, क्योंकि लोग इतने वो हैं नहीं कि खुद जाके स्क्रीनिंग करवाएं। ये मैंने ऐसे ही एक केस शुरू में जो डिटेक्ट किया है वो इस बेसिस पे कि उसे बैग ऑफ मेडिसिन वाज विथ हर बेबी, और उसमें सब दवाइयाँ थी, सब टेस्टें थी सवाए HIV के, और बच्चे की कंडीशन के आए दिन ख़राब हो रही थी, और इतनी दवाइयों के बावजूद कोई फ़ायदा नहीं हो रहा था, फीवर रन कर रहा था उसे। तो मुझे ये लगा कि दिस बेबी कुड बी द इम्यूनो कम्प्रोमाइज्ड। तो मुझे उसके बेसिस पे मैंने उसकी पढ़ा, तो हमने है अल्दो आई एम नॉट अ पीडियाट्रिशियन, आई एम अ यूरोलॉजिस्ट, तो मैंने पढ़ा तो है कि इम्यूनो कम्प्रोमाइज्ड स्टेटस वाला बंदा कैसे पिक्चर शो करता है। तो जब उसकी पिक्चर मैंने देखी और मुझे शक गुजरा, मैंने रूटीन बना ली, सब बच्चों की करवाता गया, काफ़ी रिपोर्ट्स आ गई पॉजिटिव। मेरी एक फ़िज़ा फाउंडेशन है जिसके नाम से हम अपना काम कर रहे हैं, तो मैं इनकी कुछ हेल्प करता हूँ अपने पॉकेट से। तो हम जाते हैं, इनको समझाते भी हैं, अवेयर भी करते हैं, और एजुकेट करते हैं हम इन पेशेंट्स को, बिकॉज इफ़ दे विल बी एजुकेटेड they will be not a burden on the society, और ये अपने बच्चे को ठीक तरीके से हैंडल कर सकेंगे और लोगों को ये मुंतकिल करने का सबब नहीं बनेंगे।
Politically, the people are pressing and they are putting the pressure over Sindh AIDS control program and screening camp people that don't show and don't raise the number, minimize the number as much as you can. This has been issued.
This is an instruction.
Yes, this has been ordered by the government of Sindh and the Minister of Sindh Health. Minister of Health, Dr. Azra Pechuo, she repeatedly came here 2-3 times. And she was saying there's a young doctor, he just took the case and in his hands and he violated the case. He was saying regarding me, he violated the case. of this HIV. He came in media. He shouldn't come in media. He should come in come to us even.
Why didn't you go to them? Is it because you thought
because they
wouldn't
were not
respond?
serious? Even they have become too much related to this problem, but still they are not showing their seriousness. So पहले क्या दिखाते हैं? Rest of world, the babies are also HIV positive. But they play normal life, they go to schools, they go to mosques, everywhere they do whatever they want to do. यहाँ पर एक बंदे को जब HIV का पता चल जाता है, वो वेट बाउंड हो जाता है, उसे इतना यानी वो खौफ नजर आ जाता है कि अभी क्या करेगा वो, क्योंकि इतना मसला है ये HIV का कि वो कहेगा बस अभी मेरा मौत ही है, उसमें क्या करूँ, यानी उसे कोई राह नजर नहीं आती। ये गवर्नमेंट का काम है कि जो रिलेटेड इदारे हैं उनका काम है कि उन्हें समझाएं कि बाबा ये ऐसी बीमारी नहीं है, आप इसके साथ अच्छी ज़िंदगी नॉर्मल लाइफ गुजार सकते हैं, लेकिन नॉर्मल लाइफ 100% नॉर्मल लाइफ विदाउट एनी कोमॉर्बिडिटी इफ दे आर टेकिंग ARV ऑन रेगुलर बेसिस।
I'm here in Islamabad at the UNAIDS office, and I'm joined by the country director of UNAIDS, Ms. Maria Elena Borromeo.
It's a bit alarming, I would say, when you are the second fastest growing HIV epidemic in the whole region, but also because prevention coverage is low, and even treatment coverage remains to be one of the lowest in the whole Asia and the Pacific.
Overall, in the world, wherever we've seen HIV and AIDS outbreak, is this the highest number concentrated in a younger population?
Well, if you talk
I've heard
about
that from several people,
Right.
so I wanted to ask you based on what information you have.
the outbreak that happened in Larkana is actually the 8th in Pakistan since I think 2003.
Definitely.
And
And
what is
14
unique, what is unique with this outbreak is that more than 80% of those infected were children less than 12 years old. And I think this haven't happened in the world. So when the Larkana outbreak happened, there was like a big shock for the whole community, for the whole province, for the whole country, but even for international partners like us. Because where in other countries, there is already a significant reduction in new HIV infection. They're almost getting to zero. Here, you can still see pockets of epidemic. And the reason for this increase or outbreaks have yet to be addressed.
What gaps do you think there are in terms of addressing HIV and AIDS in Pakistan? What are the loopholes? And is there enough work being done to spread awareness about this after the outbreak and learning that there are other causes of HIV being one of the second fastest growing populations in Pakistan?
Pakistan,
in the region.
Pakistan has committed to end AIDS by 2030. Let me start with that. So it's part of their Sustainable Development Targets, ending AIDS as a public health threat by 2030. So we are supporting the government, ensure that this will be achieved. And Pakistan had developed very clear what they call Pakistan AIDS strategy for 2017 to 2021. The responsibility for implementation, the resources need for those programs to be implemented lies now on the provincial government. So the challenge really is, how do you ensure that what have been articulated at the national and even at the provincial level will be really translated into actions? And there are several challenges here.
Right.
Of course, resources. When I look at PC1, this is where you can see government funding to specific program. There are resources for HIV. It could be for prevention. But really, when you look at where is this going? Was this released? Then you got into several very challenging access to information. How do we know that there is this, the resources for prevention was really allocated and spent, and what are the gaps? So
response has decreased in the last few months in terms of this outbreak?
Yeah, I would say
from the local perspective,
the
local agencies.
If you look at the data and you look at the reported cases now, I would say it's improving, but at a very slow pace. It's improving because suddenly, Pakistan, particularly Larkana, Ratudero was put on the spot, you know, international spotlight. And so people started to ask. And of course, when I came here a year ago, HIV was really in the backseat of the government's agenda. You talk about everything, but when it's about HIV, there is, I was calling it, there's kind of an epidemic of denial or silence that leads to inaction, as if it's not happening. So there is very low risk of perception. So an epidemic of silence, you know, people don't like to talk to it. So the Larkana event really changed the whole narrative, if I may say.
Right, because
So
it was no longer a taboo subject.
there's
either.
no, they know
was
now
now
it's
about
real,
kids.
but also they realize, country had realized that if we do not act now, this is what will happen. And the practices that had contributed to this huge number of children being infected is the same practice in Sindh and in other parts of the country.
So, in my experience, you mentioned something interesting, the epidemic of denial. And I seem to have encountered that as well when I was trying to get in touch with the Sindh government and Sindh officials to respond to my questions. Being that I had been there, I had spoken to people, I'd seen certain things that maybe were not highlighted at such a level. And some of the things that I saw was that there weren't enough things being done in terms of awareness of HIV/AIDS with
Yeah.
that population
Yeah.
in Larkana. Additionally, I saw misreporting of results at the testing center, and on top of that, it seemed like even the people that were tested positive were not being
Yeah.
educated on what the disease was.
Yeah.
So these were some of the gaps I saw, and when I contacted them, I did not really receive a response. So that's why what I want to know from you is that are there things being done to monitor the
Yeah.
testing center, and who does that accountability lie with? The Sindh government or the international organization?
Yeah. So who is leading this? Who is in charge of this? Who is accountable to this? It's the Sindh Ministry of Health. You have a very specific program for Sindh AIDS control program. So they're the one managing this, and we support them. We continue to liaise with them and try to understand what they are doing and what are the gaps that we could help address collectively.
Right, but the ability to act lies with the Sindh AIDS
Yes,
control
certainly.
program.
And the agreement is that UNICEF will start it, and in the long term, government will take over and continue this. So we cannot be here, you know, providing support forever.
Of course,
And, you know,
medicine for the treatment for HIV/AIDS is only available through the Global Fund, and you have to be registered into a network in Pakistan to be able to receive it. So
Correct.
the picture that I saw was different. I didn't really see much counseling going on. I didn't see much awareness. The medicines are only available through the Global Fund.
yes,
The treatment is only available through the Global Fund.
yes.
So is it sustainable to provide treatment to these people lifelong through the Global Fund? Is that a possibility? Will they be receiving it throughout
Yeah,
their
so
lives?
Global Fund also has its own lifespan, I would say. So they will not be here eternally. Yeah. So and this is where the discussion with government had started long ago to ensure that while Global Fund is bringing in quality
There
antiretroviral
seems to be a
therapy,
dependency
yes,
from the government, the Sindh government, on the Global Fund.
actually it's the whole country that is totally dependent on Global Fund for
the
ART.
ART
Yeah?
treatment.
So there had been now initial discussion planning for a transitioning until such time that they can be self-sustainable.
Will the outcome of this outbreak be a widespread epidemic, or will Pakistan's government and its institutions finally understand the severity of this outbreak and work towards tackling HIV/AIDS? We're here with Imtiaz Ali and his daughter. He lost his daughter to HIV. The village here is called Pelogangro. It's also in Ratudero, where we've seen this outbreak in so many children. So we're here with one such family whose daughter wasn't tested for in time, she wasn't diagnosed in time, and she didn't receive the treatment in time. And she passed away just about a month ago. She was 1.5 years old, and her name was Rida Batul. Rida Batul को उसके साथ क्या हुआ? आपकी जो बेटी है वो HIV पॉजिटिव थी, वो आपको कैसे पता चला और वक्त पर उसकी ट्रीटमेंट और सब कुछ मतलब क्यों नहीं
क्यों नहीं हो सकता? इनके पास जो है, जो हम मीडिया पर देखते थे कि इनका जो जहाज़ आ रहा था दवाइयों का, वो एथोपिया में फंस गया था। वहाँ के मुल्की हालात कोई सही नहीं चल रहे थे।
बिल्कुल,
तो
इसकी
यहाँ
वजह
पर
से
ये
दवा
जो है,
आना रुक गई
दवाइयाँ
थी।
जो है बच्चों की सही ना देते थे। बस HIV की दवाइयाँ नहीं होती थी, किसी और मर्ज़ की दवाइयाँ होती थी। हफ्ता भी नहीं गुजरा था मेरे ख्याल में कि स्क्रीनिंग कैंप से पहले बेचारी को फौत हो गई थी।
स्क्रीनिंग कैंप से पहले वो फौत हो गई थी, तो वो टेस्ट नहीं हुई थी।
नहीं, टेस्ट नहीं हुई।
तो आपको वैसे ही उसके जो
अलामत जो
अलामात
थी,
थे
जो
उससे
बताते हैं
पता
HIV
चला।
पॉजिटिव की, वो सारी अलामत उस बेचारी में थी।
आप उसके पास से डॉक्टर के पास ले जाते थे?
इस डॉक्टर मुजफ्फर गांगुर के पास जाते थे हम।
मुजफ्फर गांगुर के पास आप जाते
हाँ
थे?
जी।
तो वो जब ट्रीटमेंट के लिए जाते थे तो उनको क्या कोई ड्रिप लगाते थे,
जी।
सिरिंज दोबारा इस्तेमाल करते थे, ऐसा कुछ आपने
नहीं,
देखा
नहीं,
कभी?
वही जो हमने देखा ना खुद।
क्या देखा
मेरे बच्चे
आपने?
को जब वो
ये-
कैनुला लगा रहा था, तो वो कैनुला जो है लग तो गई, लेकिन जब चेक करी कि ये सही लगी है या गलत लगी है, तो वो चेक करते हैं डिस्टी वाटर से। जब वो वाटर लगाया तो फिर हो गई, सही नहीं लगी। तो उसने क्या किया, जो डस्टबिन में फेंकी थी नीडल स्टील वाली, वही वहाँ से उठा करके जो है मेरे बच्चे को दोबारा
ये
कैनुला पास
आपने
किया।
अपनी
जी, मैंने
आंखों
खुद
से
गुनाहगार
देखा है
आंखों से देखा, और उसी
कि
वक्त ही
बिन से, तो
मेरा
आपने
दिल
उस
पकड़
वक्त
गया।
कुछ नहीं कहा?
कुछ क्या कैसे कहा? अगर मैं, मुझे तो पता था ना कि इसकी ये बदमाशियाँ करता है। अगर कहता तो बच्चों का कहता कि चले जाओ यहाँ से, इलाज नहीं है तुम लोगों का मेरे पास, और हम क्या करते फिर और परेशान हो जाते। एक तो माँ का दूध भी नहीं पीती थी। जब इसके पास ज़ेर इलाज हुई, उससे पहले दूध पीती थी। इलाज के बाद उसने बेचारे दूध छोड़ दिया, एक थी दूध पर, ठीक है ना। थोड़ी बहुत खुराक देते थे, वो भी ऐसे उल्टी करके निकाल देते थे। मुँह में छाले पड़ गए थे, सारा कलर जो है उसका रंग सर्द हो गया था। यानी एक महसूस नहीं हो रहा था कि इसमें कोई एक थोड़ा सा ब्लड का होएगा, नहीं। फिर मुसलसल तकरीबन 22 दिन इसके पास ज़ेर इलाज रही, और मुसलसल गैस सिलेंडर भी लगा हुआ था मेरे बच्चे को। और 22 दिन के बाद ये कहता है कि अब मुझसे जो है बात ऊपर चढ़ गई, आप लाड़काना जाओ। लाड़काना में क्या लिख के दिया, सिर्फ चिल्ड्रन हॉस्पिटल, वहाँ जाओ। फिर हम वहाँ गए, वहाँ पर भी सही नहीं हुआ। फिर हमारा भाई है वो, उसने थोड़ी हमारी मदद की। फिर प्राइवेट अस्पताल में उसको बेचारी को दाखिल करवाया, वहाँ 1-1.5 घंटा भी नहीं रही बेचारी, फौत हो गई। दादा कितने गई? उधर गई।
We tried to get through to the Minister for Health in Sindh, Azraq Bechuho. However, our request to interview her was rejected. We wanted to discuss the issues we discovered there and understand the Sindh government's perspective. We also repeatedly requested the heads of both the National AIDS Control Program and Sindh AIDS Control Program, as well as a representative from the Pakistan People's Party for interviews, and they also didn't agree to speak with us. However, the weight of the blame cannot be entirely shifted to one political party. Not only is there an HIV epidemic, but hepatitis, tuberculosis, and several other diseases are still rampant in Pakistan. It is a failure of the state as a whole to provide adequate health services to its people that has caused this healthcare crisis. The lack of regulation and coordination on both levels of government has created a vacuum in healthcare provision that cannot be filled by the United Nations, World Health Organizations, or other international organizations. Due to the 18th Amendment of the Constitution of Pakistan, which was passed in 2010, many essential powers devolved from the central to the provincial governments. As a result, health services also became decentralized. Since then, there have been 3 HIV outbreaks in Pakistan. We're here today in Islamabad to interview the Special Assistant to the Prime Minister on Health, Dr. Zafar Mirza. So what actions are being taken on the national level, or rather can be taken in this sort of situation when there's an outbreak going on and the numbers are high? What actions can be taken?
This year, when in April, May, this outbreak was there in Larkana, and when we came to know about it, my first response was to reach out to the provincial health minister and ask her that what is her take on it and how they are responding to this outbreak. And she clearly was obviously doing what she could do, but at the same time, she also asked me that how we can support. Now, this is regardless to our political differences, this is regardless to of what federal structure we are in, this is also regardless to of 18th Amendment. So, not only that we started providing them the medicines, the diagnostic kits, but I also rushed myself. It's just like investigation of a crime. So you really have to go into all possible directions and see that what's going on. Right. So I immediately, from then and there, in Ratodero, I remember, I called the World Health Organization. I called Center for Disease Control in United States. And I requested them to send me an international rapid response team as quickly as possible. My doctrine is that we should depoliticize health. Health and education and other social sectors must be beyond the bipartisan politics. But in practical life, it does happen. But in case of Sindh, despite of all this, we could act together, and we still are working together.
But it seems from at least our perspective, having been there, from what we saw and observed, that it isn't depoliticized to that extent. As you mentioned, which is an ideal situation. It's not necessarily possible on the ground. But how is it possible to depoliticize it to the extent that there's a mechanism in place that is running with transparency, without these political ideologies or political tussles getting in the way of delivering adequate health care to the people?
Yeah. I think it's just a question of developing working relationships. In case of Sindh, for example, I can tell you very frankly, a lot also depended upon the health minister there.
Yeah.
Although she's from People's Party, but she's also a doctor and she's also a public health practitioner who understood that it is very important that we work together. And it's only for the benefit of the people if we work together. So we were able to work together. But there can be situations where it does not happen that smoothly. But having said all this, the question is that are our systems good enough? Are our coordination mechanisms good enough?
Right. And that's what I wanted to get to.
Is everybody on the same page? So answer is definitely no. Absolutely.
That's my primary concern.
Yeah, but it's a evolving system.
So how can this be reformed in Pakistan?
Yeah.
In your opinion?
Yeah. So in the light of 18th Amendment, for example, since I took over as Assistant to Prime Minister, I immediately set up a interministerial health and population council. Meet every 3 months. And exactly issues like these are discussed, that where we need to have a national coherence, right, where we need better coordination.
Where to get involved.
I created a task force on injection safety. And I took provinces on board. All the 4 provinces are part of this. We agreed that as long as a disposable syringe, which can be reused, continue to be available in the market, it is very difficult to stop its reusage. The disposable, reusable syringe to a auto-destruct syringe. And auto-destruct syringe is that which cannot be used after giving 1 injection.
Are those being implemented? Are they being given
Absolutely,
out to the provinces?
absolutely. So this task
at
force,
a grassroots level?
Absolutely.
Okay.
So this task force has come up with a plan, and we have taken provinces on board that by March next year, in private sector, the disposable syringe will not be available anymore.
One shouldn't hide away from numbers. One should accept them and not be in denial. Which brings me to my final comment, and you may or may not comment on this, but from what I saw, there was a lot of misreporting of these numbers as well, just to quiet down the outbreak and kind of make it seem less intense than it actually is. And that is for political gain more than anything. So like you said, the accountability mandate lies only with the provincial government, and on the national level, there can only be so much that can be done. in regards to it?
Well, misreporting of numbers happens at two levels. One, sometimes by the governments, who are afraid of the reaction that they will provoke by the public.
Which is what it seems.
Right.
Yes.
But there is a second level of misreporting, and that is by journalists. Because sometimes they don't understand the context of those figures, sometimes their sources are not reliable, and sometimes just for scaremongering or storymongering, if I may call it, people just use higher numbers, don't take responsibility for this, and I have witnessed it every day during dengue outbreak.
I'm sure, definitely.
And journalists, without understanding, keep using these big numbers.
But here, when there is evidence of reports that have been tested positive from respected private institutions like Aga Khan, and then when they're going to the actual testing center, it's coming out to be non-reactive, then it is a matter of concern for the provincial
Yeah, I don't know
government
about these details,
to be
but
hiding these numbers.
yeah, but the thing is that it should not happen if it is happening.
Healthcare reform to improve coordination between the central and provincial governments is critical in order to fill the gaps. Checks and balances need to be set in motion to regulate health services. This is the only way that medical negligence in such crises can be prevented in the future. These reforms seem distant in Pakistan's current political climate. However, a more immediate response is needed to provide people who are HIV positive with consistent treatment and the right kind of support to lead their lives. In a society that largely misunderstands HIV/AIDS, will these men, women, and children survive the social stigma they now face?
अभी भी कल एक बच्ची है, आई शुड शो द पिक्चर ऑफ दैट बेबी, वो उस्मा नाम है उसका, 2 साल की बच्ची है। आगा खान से उसकी रिपोर्ट पॉजिटिव, पीपीए शायद से रिपोर्ट पॉजिटिव। मैंने उन्हें भेजा कि आप जाएं यहाँ पर इनरोल करवाएं अपने आप को, आपको ट्रीटमेंट मिलेगा। जब वो वहाँ गए, उन्होंने उनकी स्क्रीनिंग की तो उन्होंने लिख के दे दिया कि डॉक्टर इमरान आपको गलत कह रहा है, आप जाएँ, आपके बच्चे को कुछ भी नहीं है। ऑन अदर हैंड सी द पिक्चर ऑफ दैट बेबी, शी इज़ नियर टू डेथ, नियर टू डाई। इतनी उसकी लीथल कंडीशन है, उसका मुंह पका हुआ है, सीवियर चेस्ट इन्फेक्शन है, लिथार्जिक, डेबिलिटेटेड, वेट लॉस है उसका, और अगर उसको ना मिला ट्रीटमेंट, शी विल डाई इन कोमॉर्बिडिटीज।
We're here at Dr. Imran Akbar Arbani's clinic, where a mother walked in with her 11-month-old daughter, who is not only HIV positive but has now gone into her final stages. She has AIDS, and she just got tested positive in the last week of August. So we're going to talk to Zulaikha Bibi here about her daughter Uzma. Zulaikha Bibi, आप मुझे ये बताएं कि आपको पता कब चला कि आपकी बेटी पॉजिटिव है? पहले आप लोगों ने टेस्ट क्यों नहीं करवाया और पता आपको कब चला?
वरी कराई सरकारी में ना आई, वरी आगा खान माटी में कराई तो हमारी मन असां गरीब ऐं मुश्किल को बचड़ी वजे तो इलाज ही न मिले, इलाज
Like 37 other children, her life was cut too short. Uzma passed away on September 4th, 2019, just 3 days after the interview. These were some of her precious last moments, captured on camera.
ते सूर न गुजरिया कोई जहरांझे दे कारण सिंगार बना उस चोला चिट चिट रोई रांझा रांझा कर रही वो रांझा पूछे न मैनू सादिक सुध दिन्हा होवे ओ विहालू लगे जैनू